Hello friends, in this video session we will talk about insomnia. Insomnia, many of the people are in around the world in India not able to take sleep properly at night. So what are the reasons for insomnia? Patients who are suffering from some psychiatric illness, like they are manic or they are in depression, they don't get sleep properly. The other reason is they suffer from performance anxiety, and the third reason is alcohol use. And another reason for insomnia is restless legs and obstructive sleep apnea. There are certain medical conditions which can also cause sleep apnea, like heart disease or muscle pain, joint pains, rheumatoid arthritis. There are certain drugs which can also make you an insomnia, and cause an episode of insomnia, like steroids used by asthma patients, and theophylline is also used in asthma patients, or propranolol that is used in as a blood pressure medicines. So these are the drugs which can cause insomnia episodes. There is a, or there may be an organic lesion in the brain stem, so which should be ruled out with an MRI scan. So what is the pathogenesis of insomnia is, first of all, this is predisposing factor. I mean to say that predisposing factors, that is hereditary. Second is precipitating factors. I mean to say that that is a stressor, like bad news or good news is a stressor. And third is perpetuating factors. So there are three different types of insomnia. First, acute insomnia, when a hereditarily susceptible person get a gets a acute stressor, he suffers from an acute insomnia. Then second is an early insomnia, when an hereditary susceptible person has a acute stressor and also has a perpetuating factor. And third is chronic insomnia, in the patient who is hereditary susceptible, has some stressor, not a great stressor, but a lot of perpetuating factors. So there are three types of insomnia. And how to treat insomnia? First of all, when you are feeling that you are not feeling sleep, you are not getting good sleep at night, you don't jump to sleeping pills. These are very bad in nature. First, you should think about the sleep hygiene. In sleep hygiene, you must think of keep a regular sleeping schedule. Do not force sleep yourself. Avoid caffeine. Avoid alcohol. Excessive exercise 4 to 4 hours before going to bed. Don't go to bed when you are not feeling sleepy. And the second part is stimulus control. Use the bed only for sleep, not for reading, eating, or other purposes. No television watching on the bed. No napping in the day. These are the stimulus controls which we can which are helpful in treating insomnia. So second part of the treatment is relaxation technique. And relaxation technique, you can go to any yoga teacher, and he will teach you in relaxation techniques, and that is a very good technique for treating insomnia primarily. Second is sleep restriction. Sleep restriction should be done under the surveillance of a qualified sleep specialist. You should not do it at the home. Third is cognitive therapy, means don't think negative, always think positive. And don't sleep don't think that if I am not sleeping at night, I will not perform better in the next morning. These type of thoughts makes you more insomniac. So these are the things which we should do before going to the medicines. Now after these things, if we are not able to get rid of the insomnia, we should treat insomnia with medicines. Not medicines alone, but with cognitive behavior therapy plus medicines. They are more successful. So what type of medicines? We should use benzodiazepines and non-benzodiazepines. Benzodiazepines and non-benzodiazepines, they are sleeping pills. The only difference is that they in the benzodiazepines have different structures from the non-benzodiazepines, and secondly, non-benzodiazepines have a shorter half-life. So it's better to take non-benzodiazepines when we start treatment of insomnia, like zolpidem. So this is an overview of insomnia. So whenever you feel that you are not sleeping, you don't jump to the benzodiazepines or a sleeping pill. You must go through the flow chart. Like you should do sleep hygiene, then you should go for relaxation technique, then you should go for cognitive behavior therapy, and lastly, when all the treatments are not successful, then you should jump to cognitive behavioral therapy plus a non-benzodiazepine type of drugs for 6 to 8 weeks with the consultation of a sleep specialist or a doctor. Thanks for watching this video. This is for the information purposes, and if you like the video, please click the button like, and if you have some questions, you can pose the questions also. Your doctor, Dr. Amit Gupta. Thanks for listening. Bye bye for now.